بسم الله الرحمن الرحيم الحمد لله وحده والصلاة والسلام على من لا نبي بعده أما بعد السلام عليكم ورحمة الله وبركاته. Welcome to today's lecture on Muslim mental health research needs and recommendations. Today's lecture I wanted to just give you a brief overview of some of the research on the mental health of American Muslims and the needs of the American Muslim population. So how does the American Muslim population compare to the average population, the average American population? A lot of times we have these inferences or ideas that we are either doing worse or better, our marriages are just the same in terms of divorce rates or similar or worse. But without hard and fast data, it's hard to make those sorts of leaps. And so the intention of this lecture was to be able to provide some tangible data as to sort of an overview and landscape of what American Muslims are dealing with. So this is going to hopefully just demonstrate to you the need and the gap or the behavioral health care disparities in making services, Muslim mental health services, accessible to American Muslims due to the overwhelming need, because we do know that the ratio of providers to people with mental health distress is inadequate and low. That there are a lot of Muslim mental health issues in our community, but there isn't too many providers to provide outlets for those sources, especially those that focus on Muslim mental health or offering treatment within an Islamic context. So before we get into the Muslim population, let's just talk about in general, what is the prevalence rate, meaning the sort of rates of mental illness when we look at a 12-month span of looking at how many people are mentally distressed. And in a 12-month time span, mental illness tends to be 40% among adolescents, which is very high, and also a very similar rate for adults, about 40% as well. Other research finds that 1 in 4 people at this moment currently have a diagnosable mental illness. Other data shows that 3 in 4 marriages before the age of 27 result in divorce. And 12-month prevalence, looking specifically at anxiety and disorder, finds that the two combined accounts for 25% of the population. 25% of people, or more than 25% of people, have either a diagnosable anxiety or depressive disorder. In fact, antidepressants are so much so prescribed in the American population that there have been traces found in our water supplies. Yeah, some people find that really shocking. It's true. We have found traces in our water supplies, which is, I think, second or third only to antibiotics. And we know how often we use antibiotics for viral infections, bacterial infections. The second or third leading medication that's prescribed is antidepressants. So every 2 minutes somewhere in the US someone is sexually assaulted, which then gives us the leap that we can make there is that there's a lot of trauma going on, whether it's sexual or childhood molestation or post-traumatic stress disorder due to shell shock or war or environmental conditions. Okay, now that we looked at the average American population, let's take a look at the American Muslim population. American Muslims are less happy than the average American. This is a Pew poll that found that was conducted in 2007, a very large-scale Muslim, American Muslim study. Anxiety disorders in American Muslims show similar prevalence rates to the American national average. So the American national average, according to the NIMH, National Institute of Mental Health, finds that 18% of people in the U.S. within 12 months time span have a diagnosable anxiety disorder, and that's pretty high actually. And and American Muslims show similar prevalence rates. So if we're looking at depression and anxiety combined, we're looking at over 25%, very similar to the average American population. PTSD for Muslims suffering from 9/11 trauma, trauma from wars in their native countries, and discrimination is actually even more in the Muslim population than in the average, population. And there's also data to show that 47% of Muslim college students reported using alcohol. In the same study, we found that 16% binge drank, and we also found in other studies that there's almost 50% of premarital sexual relations that takes place among Muslim college students as well. You can look at the FYI, as Dr. Samir Ahmed, who has actually a lecture in this course, part of the Family and Youth Institute, has really good data on this. And so, I mean, this is pretty alarming in that the average American population is pretty distressed relative to the rest of the world, despite the fact that we're the most economically advanced or successful in the world. We are also among the most anxious, sad, and depressed people in the world, with very high usages of alcohol and drug abuse. And this is even more alarming for us as Muslims because we know how much it's culturally and religiously sanctioned, the usage of alcohol. It's also a reality check that the average American Muslim is, in being able to relate to Muslims, we need to be able to be realistic and being able to understand the social context. So if we're talking, at a really high level, approaching adolescents or Muslim college students with an expectation of a very high level of religiosity, that might not be very appropriate, and it's very important for chaplains to know this because of the communal sort of nature of their professions, that they're engaged in the community and out in the in the workforce in the community, doing the service of Deen, khidmah of Deen. American Muslims are also the least likely to have someone they can count on if they're in trouble. This demonstrates the disadvantaged nature of social supports for American Muslims. Part of the reason for this is that there might be the phenomenon of immigration, right? There might be Islamophobia. There might be less willingness in some settings to have public displays of Muslim gatherings in particular cities more than others, in certain states more than others. For example, I know this recent Eid that passed, Eid al-Adha, the people did not want to congregate, especially given the election season, the Trump election season that was kind of coming by, where it put Muslims in a more state of fear, that they didn't want to have Eid al-Adha in communal places or large spaces. They want to have them in masajid, as opposed to maybe renting out large stadiums and stuff like that. It also speaks to, when we talk about social supports, the increased need for communal support. People like chaplains and imams and religious figures and brotherhood. إِنَّمَا الْمُؤْمِنُونَ إِخْوَةٌ. The Quran says that indeed the believers are brothers and sisters. تَعَوَنُوا عَلَى الْبِرِّ وَالتَّقْوَى. Come together, assist each other in doing good, and acts of righteousness. So there's a very communal calling within our tradition, and there's lots and lots of data to demonstrate that having strong social supports produces a lot of resiliency against psychological distress. It's one of the most powerful deterrents and sources of prevention and creation of resiliency for psychological distress, to have very powerful social supports. What about marriage? This is a hot topic oftentimes. At Khalil Center, we actually had a Muslim marriage convening. I would highly recommend that all of you read the ISPU report. which is what we presented to a convening of imams and leaders, Muslim leaders. It's very useful. Go on the ISP website. Hamada Hamid, who has a lecture or two in this course and has lectured in the past, was a principal investigator in that as well. American Muslim divorce rates, by an estimate here, which is an educated estimate based upon looking at just reports or certificates of marriage and divorce, was estimated at 32% by Bayunis in 2000. But a more recent study, though I would caution you to exercise to take this one with a grain of salt, the one by Al-Shughairi in 2010 was a California study, which is an estimate of which was 21%, which is maybe not as generalizable to the average population due to multiple things, because it was in California, in the Bay Area. People that live in the Bay Area might have a particular demographic, and majority of those people were middle to upper class, young adult working professionals that they did this study on. Though 21% is kind of low, if we look at the study furthermore, it demonstrates that even though those 79% of individuals that remained married, they had significantly negative interactions, almost 70% of them, and over 50% had at least one moderate to major issue in their marriages. And in fact, at Khalil Center, it's probably the top issue that we deal with, and Khalil Center does have a good pool of candidates. If you don't know much about Khalil Center, you can look it up, KhalilCenter.com. I'm the executive director and founder of the institute, and it's a psychological and spiritual wellness center that integrates the Islamic tradition into a modern psychological practice. And we have a large pool of data and sample where we see over 600 cases in a given year. And for us, it's actually the top issue that we deal with is marriages. One of the things that we can point to is that, and this is where you come in as clergy and as chaplains, is that people who tend to have lower religious affiliation also have greater amounts of psychological distress. So psychological and physical difficulties for adolescents, college students, and adults who hold materialistic values. Now, it's also important for you to recognize or know that this is also on a continuum, meaning that it's an overly simplistic statement to say that people who have low iman have psychological problems. That's not necessarily true. There might be partial truth to it, but that's an oversimplification of psychological problems, because something like a depression can be more biologically rooted and chemically rooted, and it's chronic and heritable and genetic, etc. Or it might be very environmentally rooted. So environmentally rooted responds very well to spirituality and spiritual perspectives, but more of the biopsycho kind of perspective, chemical imbalance or whatnot, does not respond very well to environmental changes at all, actually, and so we can't make that statement, although we can say that spirituality does definitely provide coping help and relief for psychological distress, but we don't want to oversimplify it, and sometimes we don't want to pathologize or make people who have mental illness feel worse about themselves by saying that they have a lower amount of iman. 48% of Muslim adolescents use alcohol. That gives us indication that religious practice amongst them might not be what we anticipate it to be, given the enormity of the sanction in the Islamic tradition. Further data on Muslims in the Pew study demonstrate that 63% of American Muslims say there's no conflict between being a devout believer and living in a modern society. I have a little bit of concern about this because just being a practicing Muslim living in the U.S. and with Islamophobia and working in healthcare settings where I have to really negotiate whether I can go to certain gatherings or potlucks or shaking hands or alcohol is being served, etc., presents this dilemma and conflict. And if a person doesn't see any conflict, then I get worried about that because I believe that there's a healthy degree of anxiety that is necessary. And anxiety is not all bad. Anxiety is a fear-based response that mobilizes action. Like if you're not anxious about doing your paper for this course, then you'll just take it easy and you won't do the research or do it properly. But you don't want to be too anxious either that you can't function. But people that don't feel any conflict at all, I feel a little wary about that. Maybe they're not as concerned about their practice. Many of the new arrivals say they should adopt American customs, kind of blend in, many say that it's okay to marry non-Muslim, even though we're not talking about a fiqh issue. Is it ideal? What are the marital stats on this working out? Though it definitely can work, and there is permissibility in certain instances for this. I don't think that it should be the norm necessarily, or we should think of it through the norm. And 43% of our American Muslim women wear hijab. It's not necessarily an indication of the religiosity per se, but it's just a useful overt indication or something we can look at. And 48% of American Muslims never wear a traditional dress. Not that it's mandatory, but it's just a sense of getting an appreciation of sort of the field. And let's take a look at the stigma, though. Having said all of that, and all of this, intense need and gaps in mental health services available, Muslims are not going to your average counseling centers and Muslim mental health centers, with the exception of the minority. Inayat found these 6 factors that serve as barriers for Muslims to seek out mental health providers, and it's important for U.S. chaplains to recognize these barriers, to be able to be a sort of a liaison and contact point, to be able to help triage or connect them to the appropriate sources. Muslim attitudes, typically Muslims view their mental illness through a spiritual causal explanation, which increases the necessity of Muslim mental health providers, as well as chaplains that have some sensitivity and training in mental health to help them. And let's take a look at just some data. I had some interesting data from Khalil Center, since we have a very large pool. We asked, upon intake, when somebody comes in to visit us, we ask them a set of questions just to kind of get some data from them. So we found that, so we asked this question: did you consider going to a non-Muslim therapist before coming to Khalil Center? 64% said no. And then we asked, did you visit any non-Muslim therapists before coming to Khalil Center? 76% said no. So what this says is that somehow something about Khalil Center that Muslims that would never have gone to a non-Muslim therapist and have never gone to a non-Muslim therapist are coming to Khalil Center. Now, what is it about the fact that they're coming to Khalil Center? Well, first of all, they want a Muslim. That's very clear from this. And secondly, it's this study here: how important is it that your therapist shares your religious values? And 93% of them said either somewhat important or extremely important. And how important is it that religion/spirituality is an essential part of therapy? And 93% says extremely important or somewhat important. This goes to show you that religion and spirituality is very important to the Muslim psyche, and that there's definitely those that are religiously observant among the population that 76% of them would never have gone to see a therapist, which means that they would never have gotten mental health treatment where they need to get mental health treatment. So what are the solutions? I think some imams and chaplains should have some, and Muslims should be wary of, therapists. Um, because until recently, psychology shunned spirituality. In fact, 24% of clinical and counseling psychologists believe in God. Psychiatrists are, the least likely to believe in God as well among the medical professionals. Preston Keller say that priests should stay out of therapy, therapists should stay out of spirituality. Skinner in behavioral psychology is a big name, says God is an archetype pattern of an explanatory fiction. Freud, who's the father of psychotherapy, rejected traditional religious beliefs, and he interpreted it as, our anxieties or repressed anxieties and fears of a world of danger. It's used to help us cope with that. It's a fiction that's used to cope with that reality. Now, having said that, I don't want to, cast such a negative impression on the field, because there's a lot of hope actually, and a room for hope and growth, because spiritual psychology and cross-cultural psychology has been exploding recently with the research. In fact, there's a paper, some of our papers are testament to that. And APA has created a division of spirituality. There's concentrations in schools that focus on spiritual psychology. Lots of research. Though it's not the norm, and though there's recommendations for spiritual intakes as well, spirituality to be integrated in the intake, and it's still not common practice, there's a lot of room for the integration. And this is great news for chaplains, because this is where that intersect happens, where there's a lot of gray area and unknowns about spirituality that the chaplains can sort of plug in and maybe provide some expertise and collaborative care to help with the mental health treatment process. So given the ratio of individuals, lack of therapists to amount of Muslim patients, what are some solutions? Well, Khalil Center offers web therapy. That's a solution. We're the only, at this point in time that I know of, the only platform that offers web therapy in a HIPAA-compliant professional way with a team of providers. And then and then Khalil centers are also spread out through California and Illinois, and soon to expand. And then we have and then if you can't find that, or somebody's not appropriate for web therapy, or they're not close to a center, then a collaborative care strategy is important. Imams or chaplains can be supportive, and they can actually hold mental health care providers accountable. How do they do that? Well, they can tell their congregant or the person that they're going to, when they go to meet the mental health provider, A, to request a culturally sensitive, spiritually sensitive provider, and B, ask the person who's going to go see them for a release of information, so that you can request that there be a collaborative approach. And this will filter out those individuals who have biases. Mental health providers should appreciate the inclusion of spiritual practitioners or chaplains. And if they say no, then maybe it's useful to be wary of them. But if they welcome it, then it might be great, and they can actually reach out to the chaplain to ask certain questions. Say, hey, I'm going to try this intervention strategy. I'm not sure if this is going to work well with this Muslim patient. What do you think about that? Are there any Islamic considerations or sensitivities that I should know? And again, providing adjunctive support and collaboration with mental health team, and then providing spiritual coping tools is what chaplains can definitely do. And this course that we're providing, and follow-up courses such as the 2-week intensive, I think is just a bare bones. I think it's a requirement and prerequisite for every imam and every chaplain to absolutely have, and they should have some orientation and understanding of psychological distress and some strategies to be able to manage crises, and to have some tools and intervention strategies from counseling psychology and mental health providers to enhance their professions. I think it should definitely be included as part of the training in theology programs, in madrasas, in Islamic studies programs, and credit to Hartford for really buying into this idea and including this course as part of their offerings at the seminary. Again, recommendations would be useful for Muslim clergy to open the doors of communication between professionals, and if possible, a treatment team approach taken for clients who may request such services. And Koenig's 2002 recommendations I put up here. He's a psychologist that recommends for continuing education credits for clergy in clinical care, and he recommends that clinical professionals seek consultation, have a relationship with, clergy, and the two together to reach out to each other for consultations in one another's respective domains. And referrals should be sought for ruling out psychological issues by religious bodies. Right? So instead of ruling something a religious problem or spiritual problem, let's do a psychological assessment in the same way that a psychologist needs to do a medical eval before they determine that this is psychological in its origins. Similarly, it's important that clergy do the same. And I know that in Malaysia, this is actually a new practice. We actually had a team of providers from Malaysia come out here that do ruqya and traditional healing centers, and they actually have part of their treatment team, psychologists, mental health providers, that rule out psychological issues prior to them administering the psychological intervention. The religious interventions. Okay, so equip yourselves, continue this course, do well at it, register for the 2-week hands-on course, and Khalil Center has a 3-city tour that we're trying to launch annually. Look out for that on the website, and it's an 8-hour full-day first responders training. And that concludes our course for our lecture for today. جزاكم الله خيرا وآخر دعوانا أن الحمد لله رب العالمين.